Joining us now to talk about the new coronavirus is Dr. Karl Henson. He's an adult infectious disease specialist from the Philippine Society for Microbiology and Infectious Diseases. Good morning, Dr. Henson, and thank you for being here in New Day. Now, let's start with what exactly is a coronavirus? Why all this news about this new or novel coronavirus?
All right, coronavirus is basically a large family of viruses. So there's bacteria, virus, parasite, and all that.
Right.
And there are a lot of viruses that can cause human diseases. We know flu, one of the more popular ones, measles, etc. So coronaviruses, they can cause a spectrum of diseases from the simple cold, common cold, to very severe infections like SARS, for example, or MERS, where they can cause more severe manifestations of disease.
So SARS and MERS are in the same family as this new or novel virus that we see, which originated from China. Now, there were news that some people already died because of this in China, not here in the Philippines. There are no reported cases of mortality here in the Philippines. But those who died in China, are there cause for concern that it could affect us, or were there other conditions that brought about this?
Right. So the novel coronavirus that they're calling 2019-nCoV has claimed the lives of four, according to the WHO. The New York Times is reporting 6. And according to the WHO, the people who died, they were pretty sick. They had pre-existing medical conditions.
Okay.
So they were more predisposed to more severe infections and worse outcomes.
Okay.
But in terms of whether the virus is deadly in itself, we just don't know that at this time.
So we don't know yet if it is truly something that will cause mortality in a larger scale. But should we be concerned about the speed in which this virus is spreading?
I don't know about the speed, because when it first took off from Wuhan, the initial announcement from the WHO was that there was no human-to-human transmission. And that, I think, says a lot about how the virus is spread.
Right.
Initially, they were confused. They were thinking that if there was human-to-human transmission, it was very limited. So it seems to be spreading not as fast as, say, a flu outbreak, for example.
Now, what are the signs and symptoms, doctor, that we should be worried about?
Right. So the novel coronavirus is like the other coronaviruses that can cause respiratory symptoms.
Right.
So the most common ones are fever, cough. You can get shortness of breath. But the important thing for the novel coronavirus is travel to Wuhan. At this time,
a history of travel
to Wuhan, or contact with someone who's sick and who was from Wuhan,
China.
Right.
So a lot of moms and parents out there might be thinking or might be worried about this type of virus since we don't know much about it. Should they be concerned? I mean, what I'm talking about is a lot of moms might be scared of bringing their school to work because a classmate has a bad case of the flu. Should they be worried about this?
At this point, I don't think so. There are a lot of viruses that can cause symptoms that are similar to the presentation of novel coronavirus.
Okay.
It can present as a common cold and like flu-like illness, I guess is the better term. So as long as there's none of the risk factors that we are looking for, then they really shouldn't be worried.
Now, how is this transmitted? How is this new coronavirus transmitted?
That's the thing. Well, for the initial transmission, we think, or WHO thinks, it might have come from some animal in the market, right? But what animal and how it was exactly transmitted, we're not sure yet. But in general, viruses that can cause respiratory infections are transmitted through droplet, meaning infected saliva or a cough that when you spew out saliva and then the person inhales it, or you touch the infected secretions of another person and then you touch your nose.
Okay.
the more efficient way to spread
So
viruses.
it's basically similar to how a cold spreads.
Right,
It's
or a flu, yes.
Right. Now, there have been reports that a vaccine now, this quickly, is being engineered or being developed in the U.S. Is this something that is hopeful or something that we should be looking forward to?
I think it's definitely hopeful, but a vaccine is a year into the future. The good thing about coronaviruses, I think, is it doesn't mutate as fast as influenza.
Okay.
And the reason why we need to get yearly flu vaccines is because it changes every year. For coronaviruses, their genetics are more stable.
Right.
So once they come up with a vaccine, it's probably going to work better than last year's flu vaccine.
Now, another thing also, Dr. Karl, for those who feel like they have the flu, they have a virus, and thinking about treating themselves with antibiotics, is this the right thing to do?
All right, no. In most cases, viral infections do not need antibiotics. The only reason for one to get an antibiotic is if your doctor determines that after a flu or after a viral respiratory infection, you develop a secondary bacterial infection. So antibiotics only really work for bacteria, and you need the doctor to tell you if you have a bacterial infection or not.
Okay, and now last question, doctor. Information about this is scarce, so we're developing it as it goes along, but what can the public do in order to keep safe? So what type of precautions can they do?
I'd like to echo here what Dr. Duque yesterday emphasized in the press conference. Hand hygiene is very important. Like I said earlier, the virus can be passed on through secretions and through your hands. Right. So when you wash your hands very frequently, either with soap and water or with a rubbing alcohol, 70% alcohol, that's the most effective way to prevent transmission. Also, good cough etiquette. That means if you're coughing, you wear a mask or you cover with your sleeve. If you do use your hands, wash your hands immediately. And then there's, of course, some more advice about when you travel, maybe don't touch live poultry or any exotic animals, just maybe until we determine where the novel coronavirus is coming from.
Okay, definitely good advice that everyone should listen to. Thank you very much, Dr. Karl Henson, adult infectious disease specialist.